We're here today to talk about regional nerve blocks. Regional nerve blocks are something that we use to help people with post-operative pain. We use an ultrasound machine to locate the nerves, and this can be done in several areas. For example, if someone is having a shoulder surgery, we can block the nerves in this area where they come out. Or if someone is having an ankle surgery, we can block the nerves behind the knee. And this is done using ultrasound guidance. What it does is help with pain after the surgery. It's not used for the anesthesia itself, but what it really does is help us cut down on the amount of anesthesia we need in the operating room and on the amount of narcotics or pain medicines we need to give after the surgery. These blocks can last for anywhere from 16, 18, maybe even up to 20 hours, and it can be very helpful to get people through that first day after surgery. Not everybody is a candidate for these blocks. Some people with lung disorders like COPD or severe asthma may not be a good candidate, or if people have bleeding disorders or on blood thinners, then we can't do the block. But for those people who are good candidates, it works very well and they seem to be very pleased with it. People who, for example, who have a shoulder surgery, who do not receive a nerve block, they go to sleep under general anesthesia, and they wake up typically in a fair amount of pain, and we can give medicines IV to help control that. However, conversely, if you have a nerve block before you go to sleep, we can make sure that it's working, and you wake up in much less pain, sometimes no pain at all. And that nerve block can be very beneficial to help you get out of recovery quicker, up to your room, and feeling better in a quicker fashion. People were doing these under what's called a stimulator, and they would stimulate the nerve. I trained where we used mostly a strictly ultrasound technique, which doesn't involve a stimulator and gives us actually a look at what we're doing. It is somewhat cutting edge, and it is now being incorporated into training programs at the bigger academic places. So that's why myself being relatively new here, I trained using the ultrasound technique. So I would say, yeah, overall it is a cutting edge procedure.